First of all, congratulations on winning the election.
Thank you.
Were you surprised to have won?
I was competing with 3 other very capable candidates, all of whom I believe would have been able to chair GPC effectively. So I consider it a real honour and privilege to have succeeded.
Okay. And so, as chair, what are your priorities? What's your agenda? Yeah.
I think the most immediate priority is to address GP workload. GPs are feeling exhausted, they're feeling overworked, and we need to enable GPs to be in control of their work. We need to enable GPs to enjoy their daily lives, and that has to be our immediate priority. There seems to be a continuing increase in workload, both generated in primary care, but also workload moving out of hospitals, and there seems to be no planned approach to ensuring that GPs are enabled to take on this work, but also no planned approach to resourcing general practice to take on this work. So the immediate priority really must be to allow GPs to be physically able to provide the care that their patients need.
Okay. Out of hours, GPC's just published your new policy document on that. Going into the contract negotiations, are you prepared to make any concessions towards the government's position that GPs need to take more responsibility for out of hours?
I think our paper is actually very clear that we do expect GPs to take more responsibility for out of hours, but our definition, which is very much in keeping with Mr. Hunt's predecessor, Andrew Lansley, is to give GPs through clinical commission groups real responsibility to organise healthcare services and have real control over healthcare resources. So we actually believe that GPs should be rightly responsible for commissioning out of hours services, but also be enabled to do that, because what we're hearing from many CCGs is that promise that GPs would be shaping and leading the agenda isn't actually happening on the ground. And many CCGs feel that they're not in a position to make those decisions. They're still constrained. They're working to instructions given to them. And in many ways, if you look at 111, this is a very good example where many CCGs have inherited a system that they have felt powerless over and have felt that imposed. Now, clearly, if we are to talk about out of hours, we need to be able to enable CCGs to get on and commission the right care for their services. I also think that it's very limited to talk about GPs in isolation and contractual issues around out of hours. We need to be much more mature and intelligent about trying to ensure that out of hour services meet the needs of patients, and that has to be a wider discussion that includes not just GP out of hours, but 111, walk-in centres, A&E minor services, urgent treatment centres, DARSI clinics. All of these provide out of hour services, and each of them provide it in a separate, disjointed manner, and we need to amalgamate and pull together these various separate providers of out-of-hour services into a whole. And we actually believe that would liberate resources that would be to the benefit of patients. One of the impediments we are finding is that the government has so far been insisting on a competitive tendering approach. And what we believe is that out-of-hours provision should be part of an integrated approach. That's been the key theme in our out-of-hours document. And the way forward would be to enable that consolidation, that coordination of service provision, rather than being diverted into processes of competitive tendering.
The lack of GPs, the shortfall in GPs, the workforce gap. Are you convinced that government's committed to getting more GPs? And are they doing enough to get the estimated 10,000 or so GPs that we need over the next 10 years?
I mean, there is absolutely no doubt that if you have a background of GPs being overworked, working above capacity, and you then have a government policy that wishes to move significant amount of care from hospitals into the community, you have to therefore, by definition, expand the infrastructure of general practice, which includes greater numbers of GPs. So I think that the government hasn't a choice in that it either wants to move care into the community or not? And if it does, you have to increase the number of GPs to enable that to happen. What I think is more important is that actions speak louder than words, and what the government needs to do is implement a deliberate workforce strategy that enables us to have greater numbers of GPs working in the years to come. Because that won't happen overnight. It can only happen if you have a deliberate workforce strategy, because GPs need to be trained. We need to make general practice an attractive career option. And what I would wish to see from government is this commitment being translated into real action.